We were telling you yesterday, of course, and you all know if your kids go to school in the Philadelphia schools, that basically the kids are going to be virtual for at least the rest of this year into next year. So our kids are really struggling. We don't have our kids playing with friends or going to school in person. A lot of the sports leagues have been canceled, particularly for the winter that are indoors, so it is tough. Here's the announcement from Dr. Height saying
we have decided to remain 100% virtual at this time. This means that our plan to begin transitioning to a hybrid learning model on November 30th.
So because of that, so it looks like it's going to be a lot longer, and particularly for families who have younger children who were slated to go back. I mean, it is devastating. It's like Lucy taking the football again. And then studies are showing the kids are regressing big time. So we have a doctor joining us right now, Susan Nicholas. Good morning.
Hey, doctor.
Good morning.
So, I mean, I think a lot of parents right now, I feel like the well is dry. Like you're just scrambling to get it all done right now, and our kids are not learning to read and write, and we're really, really worried at this time. Like, how do we just get a grip right off the bat when we have this crisis, when you're like, we were told our kids are going to be able to go back, and now they're not?
Well, thank you for this opportunity. There are a lot of forms of grief that are occurring in 2020. With COVID, with our political situations, with our social crises, there are at least 20 different types of grief or bereavement that have been described. And we can be grieving the loss of our titles, the loss of our possessions, the loss of our way of life, lots of disappointments with friends. We're losing our connections and relationships. And with this, our children have their own way of grieving, just as adults do. And one of the things I like to remind parents is to really allow your children the space to grieve. Telling your kid that it's all right or to just get over it or grow up, particularly if you have older children, it does not help at all. Really, they need their time and space to grieve. And be open as parents really to listening to your child and their feelings and validate their feelings. So you might say something like, I understand how you could feel that way, or what, for example, could be a positive side of this, kind of like the silver lining kind of discussion. Sometimes there are pearls in every situation, even if they're not readily apparent at the outset.
Could you maybe encourage them to try something they'd never tried before, to maybe, I don't know, distract them in a way?
You know, I do believe that creative expression in times of grief or bereavement or loss of any type is very constructive. But I don't know if I'd use the word distraction, because really what we want our children to do, what we want ourselves as adults to do, is really to feel through the grief, feel through the sadness or depression, not to put it off for another day or push it down where it will resurface sometime in the future.
Yeah, because sometimes you can't fix it. If you don't deal with the grief all the way through, then it can get real destructive.
Exactly, exactly. So what we tend to do as a society is we don't really speak well about grief. It's not really an open discussion that we have. We don't like to admit when we're sad or having even depressive episodes. And so we'll hide those feelings and emotions and really stuff them down. But really, this is a time for introspection, a time for really taking inventory of what we do have and looking at the changes that we've incurred and that are ahead of us. We are all entering a new normal, whether we like it or not, or we're ready or not. And really the key into going into this next phase of life, whatever it's going to look like, I'm not sure that any of us have a full idea or clue exactly what the future looks like for us, is to go in with the perspective of change and positivity, and what is the good side of this, or what are we learning from this?
I was reading this report yesterday. It was on Associated Press. It said that some kids are regressing to the point of having to go back to diapers. Now, these are really young kids, but they're like they've forgotten how to use a knife and fork, much less talking about numbers and letters and forgetting the alphabet and how to add. Do you worry that we're going to get that bad?
I think any type of regression in very young children is temporary. And we can actually see it in ourselves as adults. How many of us don't want to get up or wear pajamas all day, or don't do our normal routine?
Yeah, well, that's true.
We just lay back. It's not that we will forever be wearing sweatpants all day or pajamas or slippers, but there's a time for it that we're really, I believe we're in a phase of healing ourselves.
Yeah.
And I say this from a very broad perspective, because if we look back to this pre-pandemic era, we realize that many of the things that were essential, that the truly essential things, we overlooked. We were just too busy to be with family, to be with ourselves. We were overwhelmed with stuff to do.
Maybe we should give ourselves
And now
a
we're
break.
coming back down to a level of calm and just being with ourselves and our families.
Yeah.
It's the glass half full. All right, Doctor, thank you so much for
Thank you.
bringing us that advice and suggestions and helpfulness that we need right now. Thank you.
You know what I need in my life?
What?
I need somebody like that, like Doctor.
Soothing
Thank you.
voice, too.
She's just so calming. Yeah, YouTube, working with you two, you're yelling at me and everything, getting me all stressed out.
Keep it in line. Your phone's ringing off the hook.